Hello and welcome to the Week in 60 Minutes, brought to you by SpectatorTV and broadcast on Thursday, December 9th. I'm Kate Andrews, the Spectator's economics editor, and your host this week. I think it's worth reflecting before we dive into the show on this week's press conference and the introduction of Plan B COVID restrictions. There are lots of theories going around about the timing of these announcements, why more mask mandates, working from home guidance, and most controversially, the introduction of vaccine passports were brought in after being ruled out by the Deputy Prime Minister just a day before. We'll dig into those theories on the show, but I want to focus now on the press conference itself. There's been plenty to challenge in the countless COVID press conferences we've had on and off for the better part of 2 years. Patrick Vallance's infamous chart last October, for example, showing one scenario of cases surging and nothing else. But Wednesday's press conference was another level of spin. What the Prime Minister and his advisors were saying did not translate to what the graphs on the screen were showing us. The metrics that matter most, hospitalizations and death, have been flatlined for some time now. So, in order to claim that the data, the science now required new restrictions rushed in within a matter of hours, they came up with some disingenuous comparisons. Chris Whitty tried to draw parallels between the UK and South Africa, where he said hospitalizations were surging because of the new variant. South Africa's double vaccination rate for the whole population is 25%. In the UK, it's 70%. 95% of adults in England and in Scotland are estimated to have antibodies, 97% of the over 75s. These are not comparable countries. Whitty also tried to draw comparisons between our world now, with working vaccines, antivirals, and much better treatment and understanding of COVID-19, and our world last year without these things. He said of the link between infections and hospitalizations, quote, "You've seen how things have gone before, that's probably the way to bet. And then if we're pleasantly surprised, nobody would be happier than he would be." How can that be said with a straight face? It certainly used to be the case when we didn't have vaccines that a soaring infection rate saw hospitalizations and deaths follow. But when the government opened in July and cases surged, we saw how well that link between infections and severe illness had been broken by the vaccines. It's not fully severed. It never will be. There are still reasons to be nervous, and the government could have laid out its Plan B strategy on that basis. The unknowns about the Omicron variant, their concerns about worst-case scenarios, about a health service that is designed to operate on the brink of catastrophe, still unable to cope with any kind of unexpected plot twist. But to claim that Plan B is based on the data we have right now, it doesn't add up. And to claim last year's experience without vaccines should be looked at to compare to this year's experience with vaccines and boosters, why are they talking down the jabs? This spin would be a problem at any time, but it matters now especially. Accepting the principle of vaccine passports fundamentally changes the relationship between the individual and the state. This is a landmark moment, and the government has taken this leap without any evidence that we need them, and without any evidence that they work. Across Europe, even within the UK, we can look at Scotland, these passports have so often failed to make any meaningful difference. Over half of this year has been spent living under some level of COVID restrictions. We weren't able to sit on a park bench with another person for 3 months this year because we were told to hang in there, the vaccines are the solution. And they are the solution. But what's the solution now if they're saying this is no longer the case? What's the exit strategy for reversing Plan B and, frankly, at some point, ditching the rules that still existed within Plan A? How can we trust they're going to follow the data when they spin it so ruthlessly? Does anyone believe that next Monday, when working from home guidance comes in, that ministers in Whitehall will be following it? Nothing this week or the entire pandemic would suggest that rule makers are subject to what they mandate for the rest of us. And on that note, on to this week's show.